The year was 1840, and we were just fading our way out of the Industrial Revolution and into the Victorian era. It was the same year that New Zealand became a British colony, Canada became one nation, and essentially, Napoleon Bonaparte, the Napoleon Bonaparte, was laid to rest. It was also 1840 that hand washing would significantly reduce cross-contamination within clinical settings. Prior to that, doctors hadn't even bothered to wash their hands, moving from cadaver dissection straight across to the maternity ward without washing their hands. It's a practice that soon drew a deadly correlation between these multidisciplinary physicians, cross-contamination, and also life expectancy. In the year 1854, cholera struck. It was seen as one of the largest and deadliest of its kind at the time. It was thought to be a result of a miasma, or kind of bad air. And experts at the time sought to try and clean up the air or create systems of ventilation, but to no avail. It wasn't until they changed their theory of disease and disabled the pump that disease was able to be contained. In 1858, of course, there was the Great Stink. In 1964, the launch of smoking cessation. In 1985, harm reduction was introduced as a prevention tool to stop the transmission of HIV/AIDS. Now, the commonality between all of these different events was that in each case, somebody dared to do something differently, optimally differently, possibly unimaginable, maybe unpopular, risky even. But it wasn't until then that the change ultimately came. Now, you might have heard it said that if you always do what you've always done, you'll always get what you've always got. Now, this quote is often credited to American industrialist and businessman Henry Ford. And what he's saying here is that by repeating the same behaviors, the same processes, the same actions, you'll inevitably always get the same result. And similarly, it was Rita Mae Brown that reflected a similar sentiment in her 1983 novel, Sudden Death, where she states that insanity is essentially doing the same thing over and over again, expecting a different result. Although some may contest the cultural appropriateness and political correctness of the use of the word insanity, but that's by the by. But sadly, it's quotes just like this that are often vulnerable to misinterpretation. Because it's not just about doing things differently, we can all do things differently, but optimally differently, in a way that achieves the very best possible outcome. Now, myself, with a background in cellular and molecular biology, the scientist in me really listens to that quote and says, well, goodness, now that's top-tier science, right? It's repeatable, it's reproducible, it's reliable, fantastic. Where's the problem? Having played viola for 30 years, the musician in me says, well, practice makes perfect, right? And repetition only deepens the impression. Great, what's the issue? And having played competitive sports to a high level, I must say, the athlete in me says, well, if at first you don't succeed, just try again, of course. But I'm not sure that's what Henry Ford was reminding of us of here when he says, if you always do what you've always done, you'll always get what you've always gotten. I think what he's saying here is a little bit different. And there's something that you might have heard of called biomimicry, the mimicking of biology or science. And it speaks to the idea of transforming the way that we design, innovate, and even solve problems. And it's the founder of the Institute of Biomimicry, Janine Benyus, that describes it as innovation that is simply inspired by nature. Now, it would of course be up to us as humans to be humble enough to actually engage with what nature is trying to teach us. And there are key biomimetic principles that come to mind, including things like biodiversity or symbiosis, adaptation, words you've heard of, right? optimization, maybe less so, and of course, self-organization. And looking to things like biodiversity, it tells us that what nature is trying to suggest to us is that we can experience perspectives and workforce diversity. Easy, right? Where nature speaks of symbiosis, it talks about collaboration, communities of care, adaptation, flexible staffing, and resilient health systems. For optimization, it speaks to principles like effectiveness and efficiency. When it comes to self-organization, the decentralization of power. And all these principles and tools we enjoy talking about and discussing. We go to conferences, we enjoy the discourse around them. But what Audre Lorde suggested in 1979 was that a master's tools will never dismantle the master's house. And it's a powerful statement that essentially suggests that if we expect different outcomes, we won't get there by simply using the same systems and approaches. Now, I have found in my own work that where people have access to the right information, where people have safe and sensitive and inclusive environments, where people are honored for their lived experience and are given the skills and the ability and the space to develop those skills, okay? That's a point in my own research that I refer to as optimization. So that means that where people have access to information, that might turn up in the form of autonomy, right? Or citizen power, as Sherry Arnstein calls it. Where there are safe, sensitive, inclusive environments, maybe that's a trauma-informed approach that's psychologically safe. When it comes to lived experience, it should stand at the same shoulder height as professional experience and how it's honored. But either way, according to my research, it suggests that that's where the magic happens. Now, the scientist in me could not resist, of course, testing this. Because the theory is great, but until we've tested it, how do we know it actually works? And it was in 2019, after the first year of my doctoral studies, where I launched an organization that I felt had very similar principles to the ones I've spoken about previously. It was built on biomimicry, grounded in biomimicry, rooted in human-centered design, and it really sought to honor lived experience leadership. And as a result, we saw people that felt that they were centered in decision-making. We saw people functioning, having been given the right tools. And we also saw an environment that they felt was optimized for their success and for them to thrive. And that was all due to this intersectional model of thinking differently. Since that time, I've had the great privilege of taking the learnings from that organization and launching a new initiative, which was launched in 2022. That was my second organization, but this time a consultancy, which was built on learnings such as equity and thinking about how we can build capacity through adaptation, that word you saw before, but using public health principles. So equity, efficiency, effectiveness, participation, social justice, autonomy, accessibility, and even affordability. Basic public health principles. But this time I chose to focus on a broader group and of course consider the wider determinants of health. Now, I don't stand here and profess, having talked about the historical examples of public health, and some ways in which I have reconsidered how we can think more optimally and do things differently, to have all the answers. Absolutely not. But I think based on a bit of my research and some of the things that we're learning here together today, that there's an opportunity for us to consider the evidence and some of the community insight that's come up along the way to suggest that actually, here we are again. If you always do what you've always done, you'll always get what you've always got. Henry Ford said it, I didn't. Thank you.